Now, as you may know, chemotherapy plus nivolumab is widely accepted or approved standard first-line treatment for gastric cancer. So a checkpoint inhibitor is now used from the first line for most patients. Now, somehow, some debate, especially for CPS low population, because the hazard ratio for overall survival or benefiting overall survival is not clear in CPS or PD-L1 low population. But anyway, this chemotherapy plus nivolumab is a standard but not perfect. And finally, most patients experience the disease progression. And as mentioned before, some patients with a PD-L1 low had a very small benefit. So to overcome this kind of resistance should be very important. And as previously mentioned, immunosuppressive cells like mMDSC or other immunosuppressive fraction like regulatory T cell or macrophage is also reported to be correlated with the resistance from other research. So to overcome this kind of resistance might be very important for gastric cancer. And actually, combination with other treatments such as tyrosine kinase inhibitor or other checkpoint inhibitor are now investigated in gastric cancer to overcome this kind of resistance. So hopefully, this new treatment may improve the outcome of gastric cancer population. So this may be one of the important unmet need, resistant population after checkpoint inhibitors. Another important unmet need population is a localized gastric cancer. Nowadays, perioperative chemotherapy, especially FLOT, is a standard treatment for such population, followed by gastrectomy or esophagectomy. But still, nearly half of patients experience the disease progression even after curative surgery. So to reduce the recurrence after curative treatment must be very important. For that point of view, now checkpoint inhibitor is investigated in such population, and hopefully we have some result in near futures.